All right. Welcome back. It's good to see you.
Hello. You too. How are you doing?
Doing good. Ready to get back into it after all the holidays.
Good.
All right. First Medication Monday question. Lexapro, what can you tell us about it?
Lexapro, very good medication for folks who have generalized anxiety and major depression. Lexapro is an antidepressant, but it's often prescribed for anxiety. And patients who have anxiety who get prescribed this often wonder, why did my doctor just prescribe me an antidepressant? However, it's used for both, and that's the reason. It's in a classification called a serotonin reuptake inhibitor, which basically it raises serotonin in your brain, and over a week to 2 to 3 weeks, it changes some of the neuronal structure in your brain positively to help reduce anxiety, to help with focus, and to help with mood. And what's good about Lexapro is it doesn't interact with many other medications, and it's pretty well tolerated. It doesn't cause as much weight gain as some of the other medications. It doesn't cause a lot of sedation, which is good. But this medication can cause a reduction in libido. It can prevent people from having an orgasm, which is like 40% of my patients might report some of those symptoms. So that's kind of a brief overview of it. Other things you want to know about it, I could probably say a lot, but.
So how do you know if it's the right drug or the wrong drug for you?
Yeah, so part of that comes down to the diagnosis, and it's important to work with a clinician that's well-trained in making a proper diagnosis, of course. So if somebody actually had clinical like major depression or generalized anxiety disorder, and they did not have bipolar disorder, and they didn't have psychosis such like schizophrenia, that type of thing, then Lexapro can be prescribed for that. Aside from that, if somebody had never been on medication before for those conditions, it's often a good one to start because it has a low side effect profile. So that's one reason to start it. It also depends on one's age as well. Mm-hmm. So sometimes if somebody was older, like in their 60s or 70s, we might utilize that medication because it interacts less with other medications. So there's a lot of things that the doctor might be thinking that come into factoring in when they're prescribing it. So it's really, the burden shouldn't be on the patient to say, hey, I should take Lexapro. It's usually the doctor that might want to present it.
Is it an easy drug to start? And is it an easy drug to get off of?
The good question. So it's relatively easy to start. When starting any medication in that class, the SRI class, when you raise serotonin gets raised in your gut and in your brain. So when you raise it in your gut, it can cause some nausea or some gastrointestinal distress, like you got a lump in your throat or your tummy's rumbling or even some loose stools or diarrhea. Now, sometimes it makes people feel like they're on caffeine and it's too jittery and it causes like some twitching in their jaw and they can't tolerate it and they can't start it even. However, oftentimes these symptoms are mild and you can take it for 2, 3, 4 days, and as you're taking it, all those things kind of dissipate. Now, if you're on Lexapro for months, let's say, and you were to stop it abruptly, that your mood could tumble if you're on a high dose of it. So it's one of those things that people generally the physician will have you taper off of it, and then as you're tapering off of it, it can cause some spaciness or brain shocks, which are kind of like brain hiccups, which aren't inherently dangerous, but they're like off-putting. And if you don't know what it is, it kind of freak you out a little bit. So it needs to be, discontinued in a careful way. But this is not medical advice for anybody out there listening, specifically for you per se, just a little education. You should always ask your clinician about these things.
All right, thank you.
Sure, welcome. That's it?
That's it for Lexapro.
Good old Lexapro. All right, good. Well, I look forward to talking to you next Monday.
Thank you.
Okay, bye-bye.